Hey guys, I want to thank you guys for joining me today. And today we will be continuing our talk on reflux and heartburn to hopefully give you guys some tips about how to manage your heartburn or your reflux. And so today we're going to talk about some of the risk factors for heartburn and reflux and why some people are more prone to develop heartburn and why some people are more prone to develop reflux. And hopefully by knowing these risk factors you can adjust them so that you can manage your heartburn and reflux without having to do any type of medication or anything else to help control your symptoms. So once again, to go back in our definition, the way we define heartburn is it's actually the reflux of gastric contents causing troublesome symptoms. You have two typical symptoms for heartburn. That includes actually burning in your chest that you feel, or heartburn, or regurgitation. These are typical symptoms for people who suffer from reflux, heartburn, or GERD. And so when somebody comes to see me and say, hey, I have burning in my chest, boom, I know they have heartburn or reflux. Or if they tell me they have regurgitation of food or acid going up into the esophagus, that in my mind lets me know that they have the typical symptoms of reflux, heartburn, or acid reflux. Now there are other atypical symptoms that a lot of people have, including things like chest pain or chest tightness, hoarseness, cough, asthma, or the sensation of globus, or the sensation of something in the back of your throat where you have to keep on swallowing and swallowing and swallowing. Now there are other associated symptoms with heartburn and reflux, including things like an upset stomach or indigestion, pain, bloating and belching, and nausea. Now there are risk factors for heartburn and reflux, and the most common and significant risk factor is obesity. This makes the symptoms of reflux a lot worse and also makes the complications from long-standing heartburn a lot worse as well. We know for a fact that obesity is a big problem in the United States, and a lot of patients who have obesity have a lot of heartburn and reflux. And what happens is that fat around the abdomen pushes on the diaphragm in the esophagus to create more of a push of the gastric contents going up into the esophagus to cause burning and regurgitation. And one of the most easiest and best ways to treat heartburn is to lose weight. Even losing a little bit of weight will help out with your heartburn symptoms tremendously. And so this is one of the biggest risk factors for both the symptoms of reflux and also the complications. What I mean by that is that those patients who have obesity are known to have a higher risk of developing what's called Barrett's esophagus, which is a precancerous lesion, and also have a high risk of developing esophageal cancer from long-standing reflux. Another risk factor is a hiatal hernia. What this basically is, this is when part of the stomach goes above the diaphragm and gets trapped above the diaphragm to cause acid to go into the pocket of the hernia to cause more symptoms of acid reflux and heartburn. So having a hiatal hernia makes it more likely for you to develop acid reflux or heartburn. Medications, a lot of medications that we put people on can slow down the gut and slow down the digestion, causing worsening acid reflux and heartburn. So things like blood pressure medication, pain medication, and even anti-anxiety medications can make heartburn symptoms a lot worse. Pregnancy, by far, it's a big reason why a lot of people have heartburn and reflux. And the good thing about this condition is that typically once you are done with the pregnancy, the heartburn will go away. But it's the same concept as having a bigger abdomen across your belly. It pushes on the diaphragm, pushes on the stomach, causing acid to go up into the esophagus, causing burning and symptoms of heartburn. Now H. pylori. So H. pylori has a weird association with heartburn and reflux. So what this is a gram-negative bacteria that affects about half of the world, but only about 80% of the population actually has, or only 80% of the population don't have any symptoms from this. Only 20% actually has symptoms from H. pylori. And these symptoms include an upset stomach or indigestion called dyspepsia. They can develop ulcers. They can develop lymphoma called malt lymphoma. Or there's even higher risk of developing cancer. Now whether there's a correlation between H. pylori and acid reflux is really hard to say. For a lot of patients who actually have H. pylori, the reflux tends to get better. And when you treat this infection, for some people that can actually make reflux symptoms worse. So it's not quite clear with the association between heartburn symptoms and having this particular infection. So now that we talked about what are some of the risk factors for heartburn, how do we as doctors diagnose heartburn? How can I tell you, hey, I think you have heartburn, or hey, I know that you have heartburn? And there are a couple different ways that we test that. And so, can a healthcare provider just diagnose you with reflux without doing any testing whatsoever? If we just talk to you, can we accurately make a diagnosis of reflux? And the answer for that is yes, we certainly can. The history alone can give us a lot of good information. And for patients who have typical symptoms of heartburn, including burning in the chest or regurgitation, that is all we may typically need to help to confidently diagnose you with acid reflux or heartburn. As long as there are no particular warning signs, for those patients, we can try an empirical trial of medication to see if you respond to that. And if you do respond, then we know safely that you most likely have acid reflux or heartburn. So yes, we can make this diagnosis without doing any testing, as long as you have typical symptoms and you don't have any warning signs that make us think something else is going on. And so what those warning signs are, they include things like if you have new symptoms over the age of 50 years old, this is a warning sign that something else may be going on. If you have difficulty swallowing or food gets stuck, or you have painful swallowing, this is also a warning sign as well. If you have severe nausea or vomiting and it does not get better, this is a warning sign. If you have unintentional weight loss, this is also a warning sign for something else that could be going on. If you have bleeding or anemia or your blood count is found to be low, this is also a warning sign that something else could be going on. Or if you get full very, very quickly, or you're not eating as much as you used to, this is a sign that something could be going on. And for these patients who have these warning signs, we would recommend for us to do an upper endoscopy or an EGD to see if there's anything else going on in the GI tract, or to make sure you don't have any long-term complications from acid reflux or heartburn. So what an EGD is, or an upper endoscopy, is a very small camera that we take a look. We go down the food pipe in the stomach to see exactly what's going on in the esophagus or the stomach, to see if there's any long-term complications from acid reflux or heartburn. We typically do this for those people who have these warning signs that I mentioned before, whether it's difficulty swallowing, food's getting stuck, or new onset of symptoms over the age of 50 years old. For these patients, we want to do an upper endoscopy. If you have somebody who has refractory heartburn or acid reflux, they're on medications, it's not getting better, they've done some of the lifestyle things, it's not getting better, we would want to do an upper endoscopy to see if they have any of the complications associated with acid reflux. In addition, we want to, if we're worried about having patients having these long-term complications from acid reflux, we would want to take a look with an upper endoscopy. And these include things like a condition called Barrett's esophagus, which is a pre-cancerous lesion of the esophagus from long-standing heartburn, or even esophageal cancer, which is a long-standing complication from chronic acid reflux or heartburn. So in summary, some of the risk factors for acid reflux, what I basically tell my patients is that if you enjoy life, if you enjoy eating a lot, having rich foods, and you may be getting obese, these are some of the risk factors for having acid reflux. But other things, pregnancy, medications, or having a hiatal hernia. The way we diagnose acid reflux, if you have typical symptoms alone, and you have reflux or regurgitation, that can let us know that you have acid reflux, and that's all we need to help diagnose these symptoms. But for those patients who have long-standing reflux, and we're worried about complications, they have refractory reflux, or they have other warning signs that make us think that something else is going on, this would be the time for us to take a look with an upper endoscopy or an EGD. In the upcoming next couple of talks, I'll be talking about some of the treatments that we can have for acid reflux, including diet and lifestyle changes that we can do. We'll be talking about some of the medications that are out there to help out with acid reflux. We'll talk about some of the risk factors that you may have heard about in the media about long-standing medications, including things like Nexium or Prilosec. Are they real? Are they not real? What should you worry about? And also I'll talk about what a particular procedure which we can offer for you, which is called the transoral incisionous fundoplication, or TIF procedure, which is a very effective way that we can help manage acid reflux without the need for surgery. And then also we'll talk about some of the long-term complications from acid reflux and some of the things you should watch out from having chronic acid reflux. So I want to thank you guys for joining me today. I would love to hear what you guys have to say. Please comment below, like my Facebook page, And I really do think that having an idea of exactly what acid reflux is would hopefully help out with some of the symptoms you may be having. I do this Facebook Live every Wednesday at 8:30 p.m. I would encourage you to join, and if you have any questions, I would love to hear from them. But thank you for tuning in. I look forward to seeing you guys next week. Thanks and take care.